there's fatty-induced liver problems, and I have to, and then when he approached me, we did the lipid profile, hepatitis profile, and I have to put him on certain regimen so that he can reduce the weight, he can reduce the fat, and for now the liver is very healthy and clean. So overweight, too much fat, fatty-induced hepatitis. The liver will be infiltrated with fat and cholesterol. The disease state. So when the liver is attacked by hepatitis B. So hepatitis B can be a cause, a primary cause. Then it will run over certain lifetime, years, before you go into when the cells are fibrosed, then it starts showing us cirrhosis of the liver, but it will be there over years. Diabetes. Diabetes will make all organs weak and fail to fire cholesterol. Those who like taking fatty meat or fatty meal of the liver. Exposure to, if you go to the Galamsey areas, if you look at the poisonous substance they use in the rivers, and during the rainy season, we have no option than to go and fetch this same water and use to cook our food. We are inhaling these metals, heavy metals. What are they going to do into our bodies? We are going to have diseases. The pregnant women are going to have children born with defects, and sometimes hole in heart and perforated anus, and a lot of complications are going to arise because these metals and toxic products are going to have effect on the uterus, and therefore the fetus is going to be exposed to these harmful chemicals. Let's be careful about the chemicals we expose ourselves to, especially when we are pregnant. The X-rays trimester. So during the early stage of pregnancy, you cannot take any medications, or every medication cannot be taken like that. You need to be careful about your medication that you take. So harmful supplement, the drugs I have talked about, the history of the liver disease. If you have an existing hepatitis, you are prone to developing cirrhosis of the liver. Causes. Chronic alcoholism. So those who have been drinking alcohol. So this is different from just taking alcohol occasionally. This time you become chronically alcoholic. You wake up from bed straight, you go to the blue kiosk. Then you have to get a thought to keep you going. Without the thought, you can't move anything. You can't do anything. So you have become dependent, physically and psychologically dependent. You are exposed the liver to cirrhosis. Chronic viral hepatitis, especially hepatitis B, C, and D, will predispose the liver to cirrhosis. Fat accumulation in the liver, non-alcoholic fatty liver disease. I've talked about this already. So all these can be caused. Iron buildup in the body, hemochromatosis. This one, you know, iron is stored there. Too much iron, and the body cannot store it. It makes sure that it is built up in the liver, is the hemochromatosis. The situation where cirrhosis can also be a cause of Wilson disease. So when you have copper accumulation, the liver fails to function properly, and that condition is called Wilson's disease. So you can read about Wilson disease and get more information. Poorly formed bile ducts. Some bile ducts are poorly formed, and therefore flow of bile become a problem. The bile cannot flow well. So there's bile infiltration, and this can lead to cirrhosis of the liver. So there is a special protein that is needed to make sure that the liver functions properly. If you are deficient of that alpha-1 antitrypsin, then definitely you are going to have problems with the liver. Infections such as syphilis, brucellosis, and other medications like isoniazid, which is anti-tuberculosis drugs. All these drugs can initiate inflammations of the liver and can lead to cirrhosis of the liver. Signs and symptoms. So signs and symptoms, we have fatigue, because the liver is the powerhouse for you to get energy. So if the liver is failing to produce the required fatigue, it's like the kitchen is closed down, so no source of energy. So that is fatigue will be the first sign you experience. Loss of appetite. Whatever food they bring to you, you can't eat. Nausea, swelling in your legs, feet, or ankles. So you are having edema because the liver will have to release certain plasma proteins. And if the liver fails to produce certain plasma proteins, the body or the blood is going to lack these plasma proteins. I made mention to you when I was explaining to you about fluid volume excess. So examples of these plasma proteins, we have the albumins, we have the globulins, we have the fibrinogen. They are there to maintain the oncotic pressure, the osmotic pressure of the blood. If there is the disease state of the liver, it fails to produce the plasma proteins, and therefore you create imbalance between the osmotic pressure of the blood and that of the tissue fluid. So without the plasma protein, the tissue fluid becomes high in osmotic pressure than the blood plasma, and therefore osmosis is defined as movement of fluids. So you see fluid moving from the capillaries of the intravascular volume into the interstitial space, which will lead to swelling and edema formation within the cells. I explained this when I was explaining fluid volume excess. So you need a good liver to give you very good plasma protein and therefore maintain the osmotic pressure of the blood, which means that once you have a balance between the interstitial space and then intravascular volume, no fluid will move, and therefore the osmotic pressure becomes zero, and that you are in a state of equilibrium. Weight loss. If you have gone to Confanogy to see those with liver problems, you see they have lost weight, so lean, because you don't have any energy for metabolism. The liver is the engine room. If the kitchen is closed, there will be no energy for you. So you feel weak, you feel lean. Itchy skin because of the toxic substances that accumulate inside the body. So it will itch the body becomes so itchy because of the icterus. It just becomes toxic to the body and it creates itching. Yellow discoloration in the skin and the eyes, jaundice. That is when the liver fails to metabolize the hemolyzed red blood cells. When the red blood cells are hemolyzed, the heme part is the iron part, and then the globulin is the protein part. The globulin becomes biliverdin and bilirubin. Bilirubin is a yellow pigment, and the yellow pigment is supposed to be excreted through the albumins. The albumins will bind to it and carry them to the liver for conjugation. When the liver conjugates it, then it's excreted through feces and urine. If the liver fails to conjugate because of the disease state of the liver, the yellow pigment stays in the blood and it colors the body and the body becomes yellowish. We call it jaundice. At far, you can see the sclera becoming yellow or jaundice. The skin becomes yellow and you see the person, oh, jaundice are chill, pow. You look yellowish. And that is where the body is not able to conjugate, the liver specifically not able to conjugate the bilirubin for excretable forms. So it can be excreted through the urine and the feces. Once it is excreted, it moves out of the blood and the body becomes fine. Once it is kept and accumulated, it is toxic, and that is where it colors the body and the eye and irritate the brain for you to get problems like meningitis and other things. So fluid accumulation in your abdomen, ascites. So once you get cirrhosis and the liver fails to function properly, fluid accumulate around the liver. The process I've already explained to you, and we describe that state as ascites. Spider-like blood vessels in your palm. If you look at the skin, that is where the doctors use to diagnose ascites or cirrhosis of the liver. The blood vessels on your skin looks like spider-like spider web blood vessels. It behaves like that. If you, especially the fair-colored people, you see spider-like web behavior of the blood vessels on the skin. Redness in the palms of the hands. If you open the patient open up the palms, it becomes so red. For women, absent or loss of periods not related to menopause. So if it happens to certain women, definitely because of loss of plasma proteins, the blood volume is low. So for period or for menstruation, they don't go through menstruation. And therefore, you might think you are in your menopause, but you are not in the menopausal stage. It is because of the liver problem. That is why. For men, loss of sex drive. So the men, you lose sexual drive. There's no energy for you to even get the sexual drive. Breast enlargement, we call it gynecomastia. Gynecomastia, that's the enlargement of the breast. Or testicular atrophy. The testicle become atrophied and you lose the drive for sex. Without the testosterone, the sexual drive will be lost. So the testicular cells that release testosterone. And if the testicular cell becomes atrophied, there will be no testosterone to give you the sexual drive in men. So you lose potency, or you lose the sexual drive. Confusion, that is where the brain is involved. When the toxic product, when the bilirubin moves through the blood, enters the BBB, the blood-brain barrier, it confuses and enters the brain tissue, where there will be confusion, drowsiness, and slurred speech. That is where it becomes centralized. How do we investigate? From the lab and the scans and then the imaging that we take. Abdominal computed tomography, CT scan of the abdomen, abdominal ultrasound. You want to check and make sure that the state of the liver is protected and complete. Okay, then elastography can also be done to visualize the abdominal cavity and then the liver. Body magnetic resonance imaging, MRI, very reliable and very, very, very specific. It will give you the morphological nature. It will give you the inflammatory process, the infiltration. If it is cancer, it will tell you everything. If it is inflammation, it will indicate. So this is very specific and very accurate. Cholangiopancreatography. So cholangiopancreatography can also be done and to also give you the idea about how the liver, the state of the liver is. Biopsy. Here, biopsy, you are trying to check whether there are cancer cells that are located elsewhere in the liver. And you want to check whether the cancer is even benign or malignant. If it is benign, hallelujah, chorus. If it is malignant, disaster, then we have to pray. Liver function test. You need to do liver function test, spell out the chemistry, the parameters, are they intact, or creatine kinase, well, the enzymes that show that there's inflammation. How is the level of the creatine kinase? How is the level of the liver enzymes? The more the liver enzymes are in the blood, the more sensitive it tells you that you are having inflammations in the body. Treatment, home care, the liver is treated conservatively. So we don't have specific care is given, conservative home care management. Medications are given to manage the condition, not to cure the condition. Bear in mind, the condition that you are treating from the liver point of view is to the medications are going to manage it. It's not going to cure it. Surgery can be done in an advanced stage. If you have a transplant, they can transplant it for you. They can take away certain lobes that are infected and you can live with another lobe. If you have a spare liver, they will do the transplant for you. Then the nursing management, you have to monitor vital signs, monitor the intake and output to make sure that the intake is not too much than the output. And electrolyte levels also make sure that it is balanced to determine the fluid volume status. Maintain some periods of rest with legs elevated to minimize edema and ascites. The edema and ascites could be dependent. If you stand more, your legs are going to be edematous. So we ask you and we encourage you that if you lie down, raise up your legs and improve venous return so that you reduce the edema formation at the lower limbs. Alternate rest periods with ambulation. So you rest more, you move around more the bed, you move around the ward or the house, you rest more. So you balance rest with ambulations. To assess the fluid retention, measure and record abdominal girth every shift. So you measure and record abdominal girth every shift. So you know if the fluid is being accumulated excessively, the abdominal girth will give you an indication. You use a measuring tape to measure the abdominal girth. And if it is increasing at a speedy rate, then you call upon the medical officers to do the tapping. We call it abdominocentesis. So you tap the fluid from the abdominal cavity and remove excess fluid, which might be putting too much pressure from the liver on the diaphragm, which is obstructing respiration. So once the person fills up the abdomen too much with pressure and fluids, the liver pushes the diaphragm up, thereby interfering with respiration. So those people with this condition are breathless and they have dyspneic signs and symptoms. So we encourage the medical officers to tap the fluids as they build up. The tapping of the fluid is a temporary measure. It's not a permanent solution to it. Weight the patient daily and document his weight. If the fluid is accumulating excessively, the weight will increase. So every morning, if you weigh the patient, check and compare the weight to the baseline. The patient reducing weight or is gaining weight or becoming worse off. Supplement as ordered. So give supplements. That is the multivitamin supplement because the liver cannot produce them. So give supplements because they are lacking in the blood. Restrict sodium and fluid intake as ordered because the liver has failed to produce the plasma proteins. Remember, the fluid system is too much in the body. And if you keep on taking another salt, the salt will retain more fluid and you worsen the case. So restrict salt intake, restrict fluids intake as ordered because already the body is full of fluids. Observe and document for bleeding gums because the liver is failing to produce plasma cells or the blood cells. So the listing, the platelets are lacking and therefore the body starts bleeding. So bleeding gums, ecchymosis, bleeding under the skin, epistaxis from the nose, petechia, you have a trace of blood under the skin, and degree of sclera and skin jaundice. All these are signs of hemolysis or bleeding. Remain with the patient during the hemorrhagic periods. If there are bleeding signs, be with the client and reassure the client and allay anxiety because once they see blood coming out, they are afraid. Inspect stools. Inspect stools for amount, the color, and the consistency because the liver may be tempted to conjugate some of the jaundice or some of the bilirubin and it will be excreted through the stools. So check if the stools are excreting the bilirubin, the color of the stool will be pale, and we call it steatorrhea, jaundice stool or fatty stools. Color will be that and consistency will be loose. Test the stools and vomit for occurred blood as ordered because there's easy lack or easily bleeding. Is the person bleeding through the stools or the vomiters? Check if you have occurred blood there, then there are signs of bleeding. Watch for signs of anxiety. Anybody going through this will be anxious. There's epigastric fullness. So epigastric fullness is there because the liver is there and the liver may be tender. Restlessness, you don't have the energy, you don't have any sense of accomplishment. You know you are losing out. The blood volume is low. The red blood cells are low. It's affecting respiration. So oxygen saturation is low and energy levels are low. You feel so weak because of the fatigue. The energy levels are not there to give you that comfort. Observe closely for signs of behavioral or personality changes. Report increasing stupor, lethargy, hallucinations, neuromuscular dysfunction. All these signs should be reported for detailed scrutiny and to diagnose or differentially diagnose other conditions, and check if the mental or the brain is involved with the accumulation of the toxins or the jaundice. Arouse the patient periodically to determine the level of consciousness. They may go into unconsciousness state. That is a coma, hepatic coma. They can go. So check the conscious level, make sure the patient brain is intact, the mindset is intact, and the patient can move on. Watch for hysteresis, sign of developing encephalopathy. So hysteresis. So you check for signs of hysteresis. These are signs to make sure that you are developing encephalopathy. When you are losing your mental faculty, then it's encephalopathy. Allow the patient to express his feelings about having cirrhosis. So that is, listen to the patient consent, listen to the patient consents, and make sure you intervene appropriately. Relieve the patient of stress, and we instill some hope into the patient, give him the assurance that the medical team is 24 hours around to provide the best of care. But how much can you do unless you transplant? You can do the transplant here. Even the kidney transplant, the Professor Plangeroux, the late Plangeroux, may he so rest in peace. That professor was spearheading with liaising with a UK-based facility to establish a kidney transplant hospital here in Ghana. So he was in the process of liaising with that facility in UK so they can also establish the kidney transplant here in this country. And this man who was doing so much for this country died during the COVID period. Prof. Plangeroux, may he so rest in perfect peace. He was doing so much well. I don't know how far people have carried it to. But as we speak now, if you should have any problem with the kidney, the only thing they can do for you in this country is to do dialysis. And even the dialysis, they have shut down Kolebus machine, and the cost is unbearable. This country, we have to be up and doing something that is life-saving. You have shut it down. People should die. Meanwhile, they have money to buy 10 times of that, 10 times, but they will not buy it. People should die just like that. Something even that is acute, that you can use the dialysis machine and take the load out of the kidney for the kidney to function again. Lack of access to the dialysis machine, people are dying. Precious lives are being lost just like that. What country are we in now? What kind of country are we in? I was talking to a friend. He said, oh, he booked an appointment that he needs a kidney transplant. And he normally they'll book you. So you'll be in a queue. He said he was walking along one of the high streets in UK, and he had a call that it is his turn, so he should rush and come to the facility for them to transplant the kidney for him. He's fine now. He's working. He's fine. Let to this Ghana alone, they have buried you a long time. What are we doing to ourselves? Allow the patient to express his feelings about having cells. So they hear, what feelings are they going to express? I'm waiting for me to die and bury me. What kind of psychological support are you going to offer this patient without the necessary dialysis machine, which is not even the curative machine, just a supportive machine? Encouragement when appropriate. Patient teaching. One patient against the following: taking anti-inflammatory drugs, especially the NSAIDs. It's a killer. NSAIDs are killers. I'm repeating it. Don't take NSAIDs anyhow. They are killers. If you keep on taking NSAIDs, so the study was done recently, and they were trying to sensitize the clinicians, especially the nurses and then the doctors, on rampant use of NSAIDs for hypertensive patients. Patients who come to the hypertensive clinic should not take NSAIDs anyhow, because chronic taking of NSAIDs can lead to a condition called nephrosclerosis. There'll be sclerosing of the renal arteries and veins, and blood supply to the kidney will be cut off. The kidney will be anoxic and will be going through scar tissues. So nephrosclerosis can be induced when you take anti-inflammatory agents like NSAIDs. So be careful about taking of anti-inflammatory drugs, straining to defecate and blowing his nose or sneezing too vigorously. Already, the liver is putting too much pressure and load on the diaphragm. And when you also try to defecate on a constipated stool, there's also a buildup of pressure. So we are saying that don't do this to cause bleeding. There could be, if the pressure is too much, it can dislodge or rupture some of the capillaries and you start bleeding in these cavities. Suggest using an electric razor and a soft toothbrush. So if they want to shave, they should use the electric razor or a very soft brush to prevent gum bleeding. Advise the patient that rest and good nutrition conserve energy and decrease metabolic demands on the liver. So rest. With this problem, what you need is to rest the body, because the body cannot produce enough energy for you to use. The little energy you have, you need to protect it by resting, and those energy will be used to recover you very, very fast. So don't overuse yourself. Don't demand too much energy when the body cannot produce it. Advise patients that rest and good nutrition, energy conserve, and decrease metabolic demands is key. So you do that. Urge him to defecate frequently, avoid constipation, small meals at a time so that the abdomen cannot become too full. So small meals at a time. Teach the patient to alternate periods of rest and activity to reduce oxygen demand and prevent fatigue. So I have talked about this. Don't put pressure on the body. Rest is the ultimate goal. You don't have enough energy. Don't overuse the energy during this period. Prevention. Limiting the intake of alcohol consumption too much or consuming too much alcohol causes the liver to swell and over time leads to cirrhosis. I've talked about this before on alcohol. Ensure intake of well-balanced diet and also multivitamin and also low-fat diet. Take some multivitamin to supplement the food that you take in because the food is not balanced. So take multivitamin, take Bico, and this can supplement whatever you have. Avoid taking NSAIDs, which can adversely impact the condition of the liver. So I have also explained this to you. NSAIDs, there could be NSAIDs-induced liver cirrhosis. So NSAIDs can reduce blood flow to the liver and to the kidneys. So the same way it does to the same way to do to the liver. So stop taking the NSAIDs. Maintaining personal hygiene to prevent infections. This is very, very key. After the toilet, after visiting the toilet, make sure you use soap and water and wash thoroughly. Vaccination for hepatitis, influenza, and pneumonia. So there are vaccines for influenza, vaccine for pneumonia, so a vaccine for hepatitis. Let's encourage and sensitize the community members to take these vaccines to prevent these infections. Maintain a healthy weight since exercise. Excessive weight gain can lead to damaging of the liver and the liver cirrhosis or liver cells. So fat, there can be fat-induced liver complications. We have portal hypertension, where you have pressure buildup around the liver area. So that can cause even rupture of certain capillaries, and that can cause bleeding. Swelling in the legs and abdomen when there is increased venous pressure around the right atrium of the heart, where venous pressure is excessively high. You see the lower limbs are always swollen, and the abdomen also becomes swollen. Splenomegaly, the spleens become excessively enlarged because of extreme work is doing to reduce the derailment and the waste in the body. So bleeding time is very short because you have lost HB, you have lost the cells, especially the platelets. Once you lose the platelets, therefore there will be bleeding tendencies. Infections The white cells are off. The lymphatic system is not working. The splenic veins or the splenic the lymphoid tissues that's supposed to release the defenses are weak and they are down, and therefore the body defenses are weak. So infections enter into the body and start spreading. Malnutrition, you don't have enough appetite. You don't need to eat. Always, you are without even eating, you feel fullness in the abdomen. So you encourage yourself to eat and eat better. Hepatic encephalopathy. So this condition, it can enter the BBB and cause inflammation of the blood, the inflammation of the tissues, and therefore the toxins enter the BBB and affect the brain tissues. This can lead to hepatic encephalopathy. Jaundice, I explained about jaundice. When the bilirubin accumulates in the blood, it colors the body and leads to jaundice. Bone diseases, demineralization. So demineralization can cause weakness in the bone. So there's demineralization, and therefore the bone becomes weak and brittle. Increased risk of liver cancer. So liver cancer, the high risk of liver cancer. So once you have cirrhosis, the liver cancer is a predisposing factor or can be a complication. Acute, non-acute on chronic cirrhosis. So there could be on and off cirrhosis. Start on acute and gradually move to chronic cirrhosis. So let's take the condition very serious. Treat it as urgent so you don't encourage it to persist. Any question before we move to hepatocellular failure? Any questions so far? Any question? Okay, so yes, Sam Ebenezer says, hope it can lead to liver collapse. Of course, the liver can fail, and that is where you go into coma without coming back. Yeah, the leaders will come and meet us at UK or in UK. Yes, that was from Evans. Evans said they'll come and meet us in UK. You give them wrong injections. Yes. Matilda Odro, just smiling. Evans Yabua, we will leave to Europe. They are all going living to Europe. Maybe say go to Kolebu. Okay. Ankara Adomako say, please ask your colleagues. So please ask your colleague for me if it is possible for me to also come there and sign, and how much will they pay? Okay, I'll do that. I will be coming there with 2 of my family members. We are willing to also sign for that. Okay, that's good. That's fine. My brother, sign up here. Okay. Okay. All right. So hepatocellular failure. It's when large part of the liver become damaged. For example, you may have, the liver is divided into 2 lobes, the smaller lobe and then the bigger lobe. If the smaller lobe is damaged, of course, it can be cut off. And therefore, the smaller lobe, the bigger lobe, when it's cut off, the smaller lobe cannot function to maintain the body's demands. So once you have a problem with any of the lobe of the liver and it's cut off, then the rest can fail. The rest can fail. It becomes damaged beyond repairs and the liver can't work any longer. So hepatocellular failure is when large part of the liver becomes damaged to the point that it cannot function anyway. You have to cut it off and maintain the good ones. So it's damaged beyond repairs and the liver can't work any longer. It is a life-threatening condition that demands urgent medical care. So cirrhosis of the liver is an emergency case and it demands life-threatening, and therefore it demands urgent medical care. Most often liver failure happens gradually over years. It doesn't happen overnight. It takes time to occur. Sometimes 10, 15 years to occur. 20 years, it will still be there. So it takes time. Most often, liver failure happens gradually over time. It's the final stage of many liver diseases. So when you get hepatitis B, when you get any of the liver diseases, and you don't treat it well, that is where it progresses from that particular stage to a liver failure stage, hepatocellular failure stage. Types of hepatocellular failure. So we have the acute hepatocellular failure, chronic hepatocellular failure. So it could be acute or chronic. Hepatocellular failure is common among people who have the chronic liver infection, hepatitis B or C. I've told about this before. So if there is existing infection that you don't treat, that infection can run over your lifetime and finally lead to cirrhosis, and therefore hepatocellular failure can result. Drink or have a drink alcohol excessively, or if you have drank alcohol excessively, you are exposing the liver too much to the alcohol dehydrogenase enzymes, and these enzymes can easily cause problems to the liver. Have pre-existing or acquired medical condition that make the liver fail more easily. If you have certain cancers in the liver will fail more often or more likely to fail. Any condition that can change the functions of the liver will affect the way it's working. It will cause failure to the liver. Any condition that makes the liver failure more likely to fail is part of it. Cause, predisposing, and risk factors. Those who take acetaminophen overdose. You have learned this in pharmacology. Pharmacology, if you take too much of paracetamol, some people combine paracetamol with alcohol. It's dangerous. Very, very dangerous. That product, the end product is very, very dangerous. Now you take it, you don't see that it will happen to you immediately. You think it's okay. You get effect later in life. The effect is worse later in life. Paracetamol plus alcohol. It's not good. Stop it. Viruses. Certain hepatitis B virus can affect the liver. Over 25 years, it will be affecting you. Then, after the years, it starts showing up. So you see that your energy levels are going down. You might have infected your household. The household may be infected. Reaction to certain prescription and herbal medication. Certain herbal products are killing other people. Others too are good. So look for the good ones and pick. Don't listen to the radio. If you listen to the radio, you have problems because they are almost all over the radio stations. But look for the best and follow them. Recently, the FDA did some rationing in the market. They combine Fanta, malt, and Coke. And then what was the name they gave it? Yes, what was the name? The FDA drug that they sent to Makofa. And come and see these media people. Hey, Makofa, it will do all the work, the tricks. Will fire now water, you get healed instantly. A whole lot of advertisement. Meanwhile, it is Fanta, Coke, and malt. Makofa. So don't rely on these media people. Meanwhile, they were claiming that it heals all kinds of diseases. Meanwhile, there's no medicinal purpose in there. So please, let us be careful about the media. They will just deceive you. Eating poisonous wild mushrooms. Some people, they take mushrooms and they die. Some of the mushrooms are poisonous. So if you don't know the kind of mushroom you are taking, don't go and take it and die. There's Wilson disease, acute fatty liver of pregnancy can also be there. Septic shock, sometimes you go into shock. Industrial toxins, Long-term alcohol consumption can also lead, that's chronic alcohol consumption can also lead to that. Hemochromatocytoma or hemochromatosis, which is excessive iron built up in the body, can also lead to this. Investigations, we have liver function test, creatinine kinase, viral hepatitis, serologies, history taking, and liver biopsy. These are the investigations you can do to arrive at the diagnosis. Clinical manifestations. Jaundice, that is you have the right upper quadrant tenderness. That is where the liver is located. So definitely there will be jaundice because of the hemolysis. The liver is failing to conjugate. So there will be trapped in the bilirubin in the blood. And that level will give you the yellowish coloration and others. So right upper quadrant tenderness and pain is present. So when you have right upper quadrant pain and tenderness, it is an indication that the liver is inflamed and therefore becomes tender and hard to touch. Loss of volume due to hepatic necrosis. So here you have lost so much volume. The liver cells are lost, or they are fibrosed or shrink, and therefore you have so much space. Hepatomegaly and may be seen with heart failure. So the fluid will accumulate and start enlarging the liver. So that is it. Hepatomegaly, when you have liver enlargement because of fluid accumulation, and the heart is also failing to pump or drive the fluids. Ascites, abdominal pain, hematemesis. So here, hematemesis, you can cough up blood. No, bleeding from the abdomen. You can bleed or vomiting blood. The coughing up is the hemoptysis. So all this, or melena, there could be bloody stools. Encephalopathy, which brings about changes in mental status. The jaundice can be trapped in the brain and start irritating the brain waves or the nerves. Breath may have a nasty sweat odor. So that is the nasty sweat odor. Can be when you breathe out. Hypotension and tachycardia, nausea and vomiting. So here you are going to have hypotensive or hypotension because of low plasma volume, and the heart is going to compensate by beating faster. Nausea and vomiting could be a cause. Or the abdominal changes, the GIT changes can lead to nausea and vomiting. The toxic substances can lead to nausea and vomiting. Tremors, sleeping or sleeplessness, cerebral edema. All this can lead to complications we are talking about. So that is the hepatocellular failure. You can't sleep, there'll be cerebral edema, there'll be tremors. Nurse and medical management of this condition. Okay, Gifty Deborah is saying that Sel was referring to persons who take paracetamol with alcohol and not with water. Yes, I didn't say if you are sick, don't take paracetamol. You can take with water, and even that one should be short. You cannot take it for so long. It will have effect on the heart. Sorry, it will have effect on the liver. So don't take it for too long. The liver will be involved if it is becoming too long. It is poison to the liver. Very, very poisonous to the liver. So each patient should be managed in an intensive care unit. So when you are managing such case, should also be at the intensive care unit where all the machines are available. In case the patient goes off, you can bring him back. They'll be on and off, on and off, on and off like that. Monitor fluid volume status. because there will be fluid retention around the liver, creating ascites. So monitor. Measure intake and output hours. So you have to measure intake and output to know whether the patient has retained too much fluids or not. Assess hydration status to make sure that the person is not dehydrated or overhydrated. Observe the skin tegel on inner thigh or forehead, condition of buccal membranes, and development of edema and crackles. Assess for signs and symptoms of bleeding. Vitamin K or fresh frozen plasma may be required to promote the clotting process. So we have to make sure that all these are available. Vitamin K, because the patient can bleed easily. I've told you why they bleed. They lack the platelets, and therefore clot delays. So they'll be bleeding. Or you give fresh frozen plasma to help with the bleeding. Measure abdominal girth, because it said there'll be abdominal swelling. So you measure like you are pregnant and you are measuring the growth of the abdomen. So you measure the girth every 1 shift to determine the progress of the ascites. Assess for respiratory status because when the abdomen becomes bloated, it will be pushing on the diaphragm to obstruct respiration. So check if the diaphragm is pushed up, then there will be difficulty in breathing. Sodium restriction of 0.5 per day and fluid retention to 1,000 mils per day may be ordered. So you can restrict fluids to 1,000 mils per day instead of 3,000 or 3 liters to 4 liters. You can have at least 1,000 mils, which is 1 liter, can be given. Institute bleeding precautions. We said there will be bleeding. So please make sure that if the person is bleeding, you have the bleeding antidote, the medications to stop bleeding, they are there. The warfarin is the anticoagulant. So make sure that you have these plasma proteins or frozen plasma. The frozen plasma is there. You have the vitamin K also there to control the bleeding. Avoid razor or blade that can lead to bleeding. Or the toothbrush should be soft, because we said there'll be gum bleeding. So avoid that and make sure that the gums are intact and there's no bleeding. So provide nutritional support, because malnutrition can also cause this. So make sure that the patient becomes well balanced. Patient is unable to eat, administer the needed supplement to treat nutritional deficiencies. If the person is not eating enough or is unable to eat by herself, then we need to make sure that the necessary supplements are all inside and the patient is well balanced. How do we prevent hepatocellular failure? Being vaccinated for hepatitis B is the first step. I don't know, I'll ask you, how many people have vaccinated for hepatitis B? How many of you raise up your hand for hepatitis B as a clinician? How many of you have been exposed to or have taken the hepatitis B injection prevention? None. We took this when we were at Tech. They come to the schools and they make requests. So we did it. Because you are on the ward, it is very important to take this as a preventive measure. If you don't take it and the condition affects you, remember there's no medication to cure it. So prevention is the goal. Prevention is the goal. Cutting down on alcohol. We said alcoholism can lead to this. Maintaining healthy weight and active lifestyle. Make sure that you don't achieve overweight. You do a lot of exercises to maintain ideal weight, and therefore you don't have fat infiltrating the liver. Following directions when using medications like acetaminophen. Don't use medication like acetaminophen like para and chew it like in chewy or some food that you are eating. Then you add alcohol to it. Don't do it. It's not good. It's a killer. having a physical examination every year, at least with a primary care provider, with screening for obesity, high cholesterol, high BP, and diabetes. So you need to do screening sessions for all this. So I was asking the CODeL people, how long do you come together to do screening for patients in the name of GCUC or in the course of your study as a community service? If you are going for interview or promotion, they'll ask you, what community service have you undertaken? And you have to tell them you have provided screening services for obesity, high cholesterol, high BP, and diabetes for community around this and that and that. And this were the turnout, and then this were the evaluation. So community service is part of your promotion. It is important. If you learn and learn and learn, and your immediate community don't get benefit from it, then your learning is useless. Whatever thing you learn, the immediate community must benefit from it. They must benefit. If they don't benefit, then what are you giving in return to those people in the communities? So complications, we have hepatic encephalopathy. So when the person goes to hepatic, that is where the toxins enter the brain tissue. The toxins enter the brain tissue. The kidney failure can also be there because of excessive fluid on it. Thrombocytopenia, the thrombocytes are present. So here, the kidneys are going to fail because of multiple organ failure. When the liver starts to fail, the heart starts to fail. When the heart starts to fail, the kidneys start to fail. So we call it multiple organ failure. So the thrombocytes are low in circulation because of the liver inability to produce it. Then there will be low sodium because of the hemodilution. There's too much retention of fluids than the sodium. So there will be hyponatremia, few sodium suspended in a lot of fluids. Any question for hepatic encephalopathy or hepatic coma? Any question before we move on that? Any question or contribution? Yes, Prince Osei, he says alcohol practice is a serious aphrodisiac. One guy, yes, it's a serious aphrodisiac, but the metabolite is toxic. Okay, after the product has been acted upon by the alcohol dehydrogenase enzyme from the liver, which is one of the liver enzymes for metabolism. So phase 1 metabolism to phase 2 metabolism, it is the toxic product that is generated, and this toxic product is going to be excreted by the kidney. Oh, it's toxic to the body. So what aphrodisiac do you need? Then you cannot go and get it from the plant, but from taking alcohol and paracetamol is a bad aphrodisiac. Don't do it. You are gradually killing the kidneys and then the liver. Hepatic encephalopathy or hepatic coma. If there are no questions, we move on. Definition.
Sir.
Yes.
Please, with the vaccine, the hepatitis B vaccine, it's like most of the times we always talk about taking the B vaccine. But I want to know, is there any vaccine for the hepatitis C and the rest too? Or when you take the B vaccine, it covers all? I want to know.
No. Vaccines are specific in their actions. But because hepatitis C and then the rest are basically orophycal, and it can be treated. That is why they are close to their minds on it. That one is mild and can be treated. It's not as dangerous as the B. That is why they are not giving that one attention. So this is a decline in the brain function that occurs as a result of severe liver disease. So when the liver goes through hepatocellular failure and the liver fails to produce or fails to function properly, then the body will be lacking of certain vital things in the blood, and that enters the brain, and therefore it just depresses on the brain and causes a coma to the brain cells. This condition, your liver can't adequately remove toxins from your blood. So it's all about accumulation of toxins. You know, whatever product that goes through the mouth enters the body, the liver will have to act on it, break it down, metabolize it, and generate or convert that toxic substance into a excretable form. So it will be excreted from the body. If the liver fails to act on these things, it is still toxic and poisonous in the body, and it will be kept in the body, and the blood will carry it through the brain. That is where it will cause inflammation and irritation on the brain. So if the liver has a responsibility to metabolize, conjugate, and make it less harmful, so it can be excreted out of the body. So in this condition, your liver can't adequately remove your toxin from the blood. This causes a buildup of toxins in your bloodstream, which can lead to brain damage. Let's see the incidence. The exact incidence of hepatic encephalopathy in the general population is unknown. It affects males and females in equal numbers because now the males are taking alcohol and the females are also taking alcohol. At some point, the females are even overtaking their male counterparts. But we would later expect that, or in the previously we knew that it is the men who take a lot of alcohol and then a lot of toxic substances. But now the females are overtaking us. Medications, tramol, and other drugs that are harmful to the liver are also being taken equal proportions. But in all this, the males outnumber the females counterparts. So I'm surprised the ratio of males to females are the same, and can occur in individuals of any age who have acute or chronic liver diseases. So irrespective of your age, it can affect you. So you have to be more careful. So that is the incident. It affects male and females equally, and it is no respect of age. Approximately 24 to 53% of individuals whose liver is bypassed by portosystemic shunt. So sometimes they have a shunt that bypasses the liver with no liver disease present, develop hepatic encephalopathy. Hepatic encephalopathy is most often associated with cirrhosis. So people who get cirrhosis move to hepatic encephalopathy because definitely there will be hepatocellular failure, and therefore the toxins will move to the brain and cause hepatic encephalopathy, which is estimated to affect 5.5 million people in the United States. 5.5 million, because they like drinking alcohol and taking anything. Approximately 70% of individuals with cirrhosis may develop symptoms of hepatic encephalopathy. So if 100 people develop cirrhosis of the liver, 70% of them, that is almost 2/3 of them, will develop hepatic encephalopathy. Only 30 will not develop hepatic encephalopathy. Stages of hepatic coma. So stage of hepatic, at this stage, so with the patients, people who are having hepatic coma or hepatic encephalopathy, they go through stages. In fact, I observed one very long time at Confanoche when a friend's brother died of liver cancer, but he had an existing hepatitis B and he did not treat it, but he was taking hard liquor. I know him. He was taking very hard liquor. We advised him and he didn't take. We advised him, he didn't take. At a point, the liver failed and he developed He was into all these stages. He went through all this, the coma stage. He went off and on and off, on and off, on and off. And one of the painful deaths you can see in this world is cancer of the liver. It's so painful. When they are dying, they scream, they cry. It is so much pain, agony pain, agonizing pain they go through before they die. It's not easy. Stage 1, which is mild, they may include a shortened attention span and changes to your sleep pattern or habits, such as hypersomnia or insomnia. So at some point, you see you are not able to sleep. Everybody will be sleeping and you'll be sitting down. You don't feel like sleeping. You feel some changes in your lifestyle, changes in your sleep pattern. You are having insomnia and so on and so forth. So it's mild at this stage. If you're able to see it at this stage and work on it, you may halt it. It may not progress further. But how many people will even go to screening at this stage and identify it? No, except you do routine screening. If you do routine screening, then definitely during the screening, we can just bounce on you and say, hey, your liver is having problems. Let's go and treat you. Otherwise, you may not be able to know. And then moderate at this stage. So we have the stage 1, which is mild, stage 2, which is moderate. At this stage, you may feel disorientated or lethargic. Extreme weakness, like you have just woke up from bed and you feel sleepy or you feel very, very weak. So as moderate stage, we call it stage 2, lethargic stage, very, very weak stage. And at this stage, you feel disorientated and extreme weakness. Stage 3, severe inability to perform basic tasks. Here, stage 2, you were so weak, you were able to do 1 or 2 things. Even when you are bathing, you have to sit down and bath. You can't stand. But when you move to stage 4, severe stage, you can't perform any routine activities. You can't bath, you can't eat, you can't groom yourself. You are just lying down flat like that. Extreme weakness. You can't perform any basic function or task. Confusion and personality changes. So the brain is involved, where even when your own people come, you can't even identify them. We ask you the time of the day and you can't even know it. So you are mentally confused and there's personality changes. Stage 4, cosmetic stage. This stage is characterized by coma. So that is the coma stage, where the person, you see the person sleeping, just continuously sleeping, he's in coma. And then you have only put on the IV dextrose, and the dextrose will be running like that. I'm telling you, if you get a liver problem here, there's always conservative management. There's no radical management or radical treatment to cure it. No, we only have to manage you conservatively and look for you to die peacefully. There's nothing we can do to transplant it or do something for you. No, that is the point. So be careful about what goes through your mouth. Be careful about what you eat. Be careful about the alcohol that you take. That you think today you are strong, so you wouldn't bother and mind. You can go on, but mind you, in the future, you may suffer for the consequences. So be careful. The exact cause of hepatic encephalopathy is unknown. However, it's usually triggered by buildup of toxins in the bloodstream. Basically, it's because of the toxins the liver is unable to metabolize, or the liver is unable to conjugate. So these toxins build up and run through the bloodstream, enter the blood-brain barrier, and go to the brain tissue and start causing problems. So that is how it happens. Risk factors or risks. Here we have kidney problems. Those with kidney problems, the waste, the kidney is an organ that filters the blood. So if the kidney function declines, the filtration process is also declined. And you have so much waste in circulation. Just like you are making a granule soup, a palm nut soup, and you are filtering the palm nut with the sieve, and there are holes in the sieve. You see that the filtrate will still contain some of the palm. It will be unfiltered properly, or to be filtered wrongly. So you have still some waste inside the blood. That is how the kidney fails to function. That is how it is. You still see some kind of toxins in the blood, and that tells you that the kidney is poorly filtering the blood. So dehydration, during dehydration, the waste, we said this under fluid volume deficit. During dehydration, the fluid dries up and the waste is stuck in the gutters. But during the rainy season, the rain flushes the gutter and the gutter becomes nice. So if you are dehydrated, remember the toxins are accumulated inside the body and they can cause harm to the kidneys. So flush yourself with more water, flush yourself with more urine. So once you urinate, you pull out the waste out so that it doesn't go to affect the liver and then the brain. Hypoxia or low oxygen levels, yes. Hypoxia or low oxygen levels will definitely produce certain actions. It will make you weak and you will not have enough energy to function or do anything. So risk people here, we have those who are in a state of hypoxia or low oxygen levels. We have problem with the liver because the liver needs oxygen to give you the energy. Recent surgery or trauma. Now you have done surgery or you have done some trauma, gone through some trauma, road traffic accident, fell from a height, or surgically you have been traumatized. It can also predispose you to have problems with the liver. Because during surgery or during the traumatic experience, you might have lost so much blood and the liver could pay the consequences. Medication that suppress your immune system. Yes, there are some medication that suppress the immune system, like typical example is prednisolone, which is a steroid, metabolic steroid, and this can suppress the immune system and it may bring about infections. Can also cause this. Too much proteins. Medication that suppress your central nervous system, such as barbiturates or benzodiazepines or tranquilizers. These medications will definitely cause central CNS depression. And once the CNS depressed, basically certain functions of the liver are also going to be depressed and malfunctioned. Electrolyte imbalance, especially when you are dehydrated, there will be electrolyte imbalance. Decrease in potassium after vomiting or taking diuretics. So once you have lost potassium, is going to affect the functions of the heart and therefore the liver. So pathophysiology. We have hepatic encephalopathy results from accumulation of ammonia. If the kidney is not able to remove the ammonia, urea, uric acids, nitrates from the urine, then to be accumulated in the blood. So you have ammonia and other identified toxic metabolites in the blood because of the liver cells' inability to convert ammonia to urea. So it is the liver's ability to convert ammonia, which is a byproduct of deamination of proteins. So when the liver deaminate proteins, definitely there will be ammonia, and therefore ammonia should be converted to urea, and the kidney will have to excrete the urea out of the body. So if the kidney fails to produce or excrete the urea to be accumulated and cause toxic products to the liver. Increased blood ammonia concentration. Ammonia is irritation or irritated. So once you have more ammonia because of reduced clearance by the kidney or overproduction by the liver enzymes, definitely ammonia levels will pile up. It is the kidney supposed to remove them. Okay, increased blood ammonia concentration leads to neurologic dysfunction and possible brain damage. Hepatic coma is the most advanced state of hepatic encephalopathy. So when the person goes into hepatic coma, the person has advanced the disease process. That is hepatic encephalopathy. What are the clinical manifestations? Anxiety, irritability, confusion, esteritis, lethargy, personality changes, amnesia, seizures. All these are signs that hepatic coma patient would experience. So medically, we can give antibiotics like rifaximin, so probiotics, lactulose. This is what they use at the wards to manage patients who are having liver encephalopathy or liver cirrhosis. They use rifaximin, probiotics, lactose. You have to be careful because you can't just administer any drug. Every drug that goes in there, the liver will have to metabolize, but that liver is diseased. So you can't just give any drug. You have to be more selective in prescription of your drugs. Give treatment according to the symptoms. So they treat symptomatically. All the drugs are not going to cure the patient. It's going to just manage their symptoms. So nursing management promote rest because of low energy. Monitor improving nutritional status. So improve your nutritional status, monitor phonological status, because the toxic will affect the nerves, and therefore you may have neurological problems like seizures and other things. So monitor neurological status, fluid electrolyte balance, because of the possibility of fluid volume excess, monitor fluid volume balance and electrolyte balance. Conscious levels of patience, encourage change in lifestyle, adequate, well-balanced diet, and elimination of alcohol. So all these are lifestyle modification. Well-balanced diet, stop alcohol, you should eat well-balanced. How do we prevent it? This condition, how do we prevent it? Avoid medication that affect the nervous system, such as sleeping pills and antidepressants. So any medication like tranquilizers, benzodiazepines, and other medication that will put you to sleep, avoid them. Eat a nutritious diet. Make sure the food that you take is balanced and it's devoid of poisonous substances. Exercise and maintain a healthy weight, especially important if you have fatty liver diseases. I saved one Reverend Father by scheduling him on constant exercise. He was having hepatitis-induced, fatty-induced hepatitis, and scheduling him on regular exercise, he was fit, very, very fine and healthy now. But if you allow fat to infiltrate your liver, it can lead to fatty-induced hepatitis. So be careful. Take your prescribed medication to treat the liver diseases. Undergo regular liver function tests. Avoid alcohol, which damages your liver cells. What are the complications? Cerebral edema. When the edema becomes pronounced in the body, it can move into the brain and you can have cerebral edema. Varicella bleeding disorders. No, varicose bleeding disorders, yes. So varicose bleeding disorder because of the low platelet levels. So there will bleeding disorders. Hepatorenal syndrome, that the kidney and then the liver will be having problems. Even in the kidney and then the liver will be having problems. Pulmonary syndrome, when there's increased hepatic increased portal pressure. So there will be buildup of fluids there. Definitely, there will be increased venous pressure on the right side of the heart, and therefore fluid will build up around the lungs. So if you have portal hypertension, there will be increased venous pressure. The pressure around the right side of the heart will be high. So from the pulmonary artery, there will be too much fluids moving into the lungs. So you have pulmonary edema coming from the heart, liver. That's pulmonary syndrome. Pulmonary hypertension can also be there. All right. So this is where we bring the curtain. We will continue from cancer of the liver next week when we meet God's will, and that will be our last lecture. Next week will be our last lecture. Then we can prepare for our end of semester. Our end of semester next week, I'll discuss them with you, and you know how to prepare for the end of semester. And as I have mentioned it, take good use of the study guide to go through the end of semester smoothly. Any questions so far? People are disturbing so much. I don't know what to say. Look, you are talking
Mr.
like
Sharon or Madam Sharon.
It's unfair to do this. Very, very unfair.
Please unmute yourself, Mr. Sharon.
Okay, so any question, contribution so far from what we've been discussing? Any contribution so far? Yes. Solomon. Yeah, Solomon, let's hear you.
Okay, thank you, sir. Please, I want to know the reason why we give antibiotics for the hepatic coma and also the probiotics.
Oh, you don't know that the body is prone to infections. They are to absorb those toxins and then the infections. Because the liver is not able to do that, they are going to help and augment the liver's function. That is why they administer all this. Even the cellulose and other things to absorb these toxins from the blood and remove them when the liver is not able to detoxify them from the blood. So it's going to augment the work of the liver. So it's not just ordinary antibiotics. And the body is prone to infections too. So once the body is prone to infections during this time, you need to give these medications to reduce the risk of infections.
I want to prescriber once told me that if people with hepatic encephalopathy and hepatic coma, we give them antibiotics. Another way is to kill the intestinal gut that produces the ammonia. I don't know if.
So it's not you are still asking the same question. It's not only a common antibiotics. We have selected antibiotics that will spare this normal flora. So you don't just mention antibiotics as if we are giving Cipro or Cefirozine. They are selected antibiotics that will spare this normal flora and will not complicate the liver's condition. So they are selected antibiotics that are given, which is friendly to the liver at this stage. So you don't just mention any antibiotics. They are specifics and selected ones.
Okay, thank you, sir.
Yeah. Any question? Okay. So I think that if there are no questions or contributions, we will bring the lecture to an end. May the good Lord be with us all, protect us from all harm. Till we meet next week. Have a wonderful weekend and bye.
Thank you.
Bye, sir.
Bye. Yes.